Hello, my name is Dr. Dewan S. Raja. Today I will discuss about opportunistic organisms encountered in cancer patients. Opportunistic organism refers to microorganisms that can take advantage of a weakened immune system, often seen in cancer patients undergoing treatment, like by chemotherapy, by means of the radiotherapy, or even during or after surgery. These organisms may cause infection that can be more severe and difficult to treat in individuals with compromised immune system. The opportunistic organisms include bacteria, fungi, viruses, protozoa, multiple bacteria, many types of fungus, viruses, protozoa may cause opportunistic infection to a patient who is suffering from immunosuppression or getting chemotherapy or having surgery. Okay, so they may have more chance to get infection. So for opportunistic bacterial infection in cancer patients like Staphylococcus aureus, this bacterium can cause skin and soft tissue infection as well as more serious infection such as bloodstream infection. That means they may cause sepsis. Methicillin-resistant Staphylococcus aureus or MRSA is a particular concern due to resistance to many antibiotics. Escherichia coli, also called E. coli, in cancer patients. E. coli infection can occur especially in those with weakened immune system. Infection may manifest as UTI or urinary tract infection, bloodstream infection, and other localized infections. Pseudomonas aeruginosa. Pseudomonas is known for causing opportunistic infection, particularly in individuals with compromised immune system. It can lead to pneumonia, skin infection, and urinary tract infections. Clostridium difficile. Cancer patients, especially those on prolonged antibiotic therapy, are at increased risk of Clostridium difficile infection, which can lead to severe diarrhea and colitis. It causes pseudomembranous colitis. There is a membrane formation in the colon, so there will be malabsorption, there may be dysentery-like symptom, there may be fever and infection. Okay, so we got that, and it is managed by metronidazole or by vancomycin. Klebsiella pneumonia, another bacteria. Klebsiella infection can affect different organs including lungs and urinary tract. In cancer patients, pneumonia and bloodstream infections are potential complications. Enterococcus species, Enterococca including Enterococcus faecalis, Enterococcus faecium, can cause infection in cancer patients, particularly in the bloodstream and urinary tract. Acinetobacter baumannii. This bacterium is associated with healthcare-associated infection, and cancer patients with prolonged hospital stays or undergoing invasive procedure are susceptible to Acinetobacter infections. Streptococcus pneumoniae. While Streptococcus pneumoniae is a common cause of pneumonia, it can become opportunistic in cancer patients with compromised immune system, leading to more severe infection. So now I'll go to the fungal infections. Candida species and other Candida albicans and other species. Candida species can cause candidiasis, which may manifest as oral thrush. esophagitis, invasive bloodstream infection that is called candidemia, candida infection are common in patients with hematological malignancy like leukemia, like multiple myeloma, and those undergoing intensive chemotherapy. Aspergillus species, Aspergillus fumigatus and other Aspergillus species can cause pulmonary aspergillosis, a potentially severe and invasive lung infection. Immunocompromised cancer patients, especially those with prolonged neutropenia, that is, decreased number of white blood cells, particularly the neutrophils, are at higher risk. Okay, here the fungus like Pneumocystis pneumonia, also called Pneumocystis cerevisiae, is a potentially life-threatening fungal infection commonly seen in immunocompromised individuals, including cancer patients. PCP can cause severe respiratory distress and is a common opportunistic infection in those with compromised immune system. Mucormycosis is a rare but aggressive fungal infection that can affect the sinus of the spaces around the nose, the paranasal sinuses, like frontal sinus, maxillary sinus. Lungs and other organs may be infected by this fungus. It is more common in cancer patients with hematological malignancies, like that again leukemia, multiple myeloma, and those undergoing hematopoietic stem cell transplantation. Okay, we got that. So we got mucormycosis, histoplasma capsulatum, can seen in cancer patients, especially those residing in endemic areas. Inhalation of spores can lead to pulmonary infection, and disseminated disease may occur in severely immunocompromised individuals. Fusarium species, Fusarium infection can cause a range of clinical manifestations, including skin lesions, pulmonary infection, bloodstream infection. Cancer patients with prolonged neutropenia are at increased risk. If we go to the viral infection, go to think first, cytomegalovirus infection, CMV, is common opportunistic virus that can cause severe infection, especially in immunocompromised individuals. In cancer patients, CMV can lead to conditions such as pneumonia, gastrointestinal inflammation, and retinitis. So it involves the inner layer of the eyes. Herpes viruses, herpes simplex virus, and varicella zoster virus. Herpes simplex virus and varicella zoster virus can cause skin and mucosal lesion. Reactivation of these viruses can lead to conditions such as herpes labialis, genital herpes, and shingles, herpes zoster, in cancer patients. Epstein-Barr virus, EBV, is associated with various lymphoproliferative disorder, can lead to conditions such as infectious mononucleosis. In immunocompromised cancer patients, like patients suffering from lymphoma for long standing, Epstein-Barr virus reactivation can contribute to more severe complications. Human papillomavirus. Human papillomavirus infection can lead to genital warts and are associated with an increased risk of certain cancer, including cervical cancer. Cancer patients with weakened immune system may be more susceptible to persistent or recurrent human papillomavirus infections. Respiratory viruses like influenza, respiratory syncytial virus, Infection with common respiratory viruses such as influenza, respiratory syncytial virus can be more severe in cancer patients. This infection may lead to respiratory complications, especially in individuals with compromised lung function, like a patient with long-standing COPD or asthma or emphysema. Okay, so we got that. Now, adenovirus infection can cause a range of symptoms, including respiratory and gastrointestinal symptoms. In cancer patients, adenovirus can lead to severe pneumonia and disseminated disease. JC virus, progressive multifocal leukoencephalopathy, also called PML, immunocompromised cancer patients, especially those with hematological malignancies, may be at risk for JC virus reactivation, leading to progressive multifocal leukoencephalopathy, a rare but severe brain infection. Hepatitis B and C viruses, cancer patients with a history of hepatitis B and C may experience reactivation of these viruses during immunosuppressive treatment, leading to hepatitis flare-ups. We'll go to the protozoal infection now. Toxoplasma gondii can cause toxoplasmosis, which typically affects the central nervous system. Cancer patients, especially those with hematologic malignancies or undergoing stem cell transplantation, may be at risk of reactivation of latent infections. Cryptosporidium parvum, another protozoa. Cryptosporidium parvum or causing Cryptosporidium infection is a protozoan that can cause gastrointestinal infection, leading to diarrhea. Immunocompromised cancer patients, particularly those with weakened T cell function, may be susceptible to more severe and chronic cryptosporidiosis. Giardia lamblia. Giardia is a common intestinal parasite that can cause giardiasis, leading to symptoms such as diarrhea, abdominal cramp, and weight loss. Cancer patients with compromised immune system may be at risk for prolonged or more severe infections. Entamoeba histolytica is a protozoan responsible for amoebic dysentery. In immunocompromised cancer patients, amoebiasis can lead to invasive intestinal infection in severe cases, extraintestinal infection involving the liver and any other organ. Leishmania species is a parasitic disease caused by Leishmania species. Immunocompromised cancer patients may be susceptible to visceral leishmaniasis, a severe form of the disease that can affect internal organs. Trypanosoma cruzi disease, that is the Chagas disease, is caused by a protozoan Trypanosoma cruzi in endemic region like South America or the Central America. Cancer patients may be at risk of reactivation of Chagas disease, leading to cardiac or gastrointestinal complication. Pneumocystis jirovecii, although traditionally classified as fungus, Pneumocystis jirovecii is a protozoan-like organism that can cause pneumocystis pneumonia. Cancer patients with compromised immune system, especially those with low CD4 T cells count, are at increased risk of PCP, that is pneumocystis pneumonia. So prevention of infection by opportunistic organism, preventive measures such as prophylaxis, maybe by antibiotic, maybe by antifungal, antiviral, vaccination, appropriate medication use when available. We have some vaccines against the infection. We can use those. Close monitoring for symptoms of infection, prompt diagnosis, and appropriate management are critical aspects of care. Maintaining good hygiene practice, aseptic precaution by everyone who handles the patient, including the patient himself, and avoiding exposure to parasites and contaminated water sources can help to reduce the risk of infection. And that's all about the prevention, all about the opportunistic infection organisms encountered by the cancer patients or in oncology. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.